Hello, viewers. You're welcome once again to the Let's Talk Health. And we've received a lot of positive feedbacks, and we are so grateful for all those nice feedbacks. We want them let's keep them coming. We also like you to constructively critique us so that we can do it a much more engaging and very educative program for you out there. Today, we're going to talk about vagina discharge. So you'll be asking, stop asking that question. That why am I here today? It's vaginal discharge. I know I have a penis. Yeah, so don't worry. So with me today to help me ask the relevant questions, it's a smart, beautiful looking young lady. Charlie, her English, don't go there.
Please relax. You're going too far.
And she's in person of Jasmine. She says she call it Gantuan. Alone.
It's Gantua.
Gantua.
Yes.
So I didn't even get it right.
No, you didn't.
Upon all the
Yes, you didn't.
Today, let that pussy drip.
Oh, no. Please leave the song alone. We are not talking about that.
But it's also dripping.
Oh, no. They are different. We have the vaginal discharge and that dripping.
That's also to help us properly digest this subject matter. Charlie, the guy, we just had a talk. He has a lot of experiences down his sleeves. Charlie, this man, he's I'm not even permitted to say this, but
You're
let me say.
overhyping.
No, he's a repertoire of knowledge. So two of us will be dealing with Doc today, and there's no other person but Dr. Victor Loglo.
Yeah.
I had that one also right this time around.
Yeah, you got it right.
Doc, you're welcome.
Right. Thank you. Thank you. You got my name right today.
Loglo.
Yes.
Not Loglo.
No, it's not Loglo or Loglo or whatever.
Loglo.
Yes. So just as you say, Google. So Loglo. It's very simple. It's one of the simplest things.
Thank you so much.
Thank you. We talk of the skin, the eyes, inside the nose. Think of the mouth, every other covering secretes something that kind of nourishes, and then keep it healthy. And so discharge in itself is a normal function of the female reproductive organ. It's a normal function. It's as a result of certain glands within the vagina, okay, and then the cervix. So not just the vagina and the cervix that secrete these, fluid to keep it, number one, free from, let me say, germs. So dead tissues. You see, every cells that covers these places, there's going to be a time that it will die off. So as a way of washing them out, the vagina produces the fluid to wash them out. So it washes out the germs. Number two, it keeps it moisturized and it keeps it healthy. Okay, so that is the main purpose. It's a vagina's way of keeping it active,
Okay,
all the
Doc,
time.
you mentioned something about it's nourishing. So,
Yes.
would you like to throw more light on that? Because I'm a bit lost.
Yeah, so it's just like your skin. You are not going to feel comfortable if your skin is dry.
Okay.
So that is nature's own way of keeping the vagina comfortable for the user. So it must be smooth. It must be soft. It must be clean. It must be healthy. These things I've made mention of. It is the discharge that causes that. So, however, the discharge changes depending on certain factors. Okay, so the discharge, if I say it changes, I'm talking about certain qualities of the discharge. So, the amount, the texture, and then the appearance may change depending on a certain stage or factor you are going through as a woman.
If you talk about appearance,
Yes.
you are relating it to like
The color.
Okay.
So how it looks like, and then the texture means how it feels,
Okay.
and then the amount is the volume.
All right.
So, and this is the reason why a woman may present to the hospital. They'll either tell you I've seen a different color from the normal I used to see, or I'm having a more quantity, maybe over discharging, or maybe it feels different from how it used to feel. So these are the three things, the three qualities: the appearance, the texture, the amount, the volume of what is coming, how it feels, and how it looks like. So we'll move to the factors.
Doc,
after. Yeah.
quickly before that, during our last episode, you were
Yeah.
talking about the what happens in the reproductive woman's. Are these things you're talking about? Are they only in the reproductive woman's life, or at the menopausal state too? There are going to be discharges. I want us to
Thank you.
to draw that
Thank
line.
you. Thank you. So that's a very good one. So, like I said, these three things can differ depending on a certain stage or factors.
Okay.
So, your question takes me to those factors.
Okay.
The first one is the menstrual cycle of a woman.
Mm-hmm.
The menstrual. So, remember, we are talking about three things. We said what? The appearance,
Volume,
the volume,
texture.
and the texture. Okay?
Mm-hmm.
So think with these three things, depending on the stages I'm going to make mention of.
Okay.
Number one is the menstrual cycle of a woman. Okay. So this is allow me to just use 1 minute to break the cycle, make it very simple so that you know what time and what time.
Okay.
You know that the first 3, 5, 7 days is a bleeding period. Okay, is a real menses, period.
Doc, sorry
Yeah.
to cut you short,
Yeah.
but is it normal to
Yeah.
have your period in 3 days?
Yes, it's normal. I just made mention of it. 3 to 5, 7
Okay,
days.
but
So
some people argue that it's not normal.
it's normal. Okay, so we'll talk about that later, but
Okay.
it's normal. Now that's a menses period. Then after that, we will have the pre-ovulation period. Okay, so the period between the last bleeding and then now to ovulation. Then we have the ovulation period itself. Then we have post-ovulation, and then we have pre-menses. Okay, just keep it like this.
Okay.
There's a reason why. Now, we are going to go back to estrogen and progesterone.
Interesting.
Last week.
These are two hormones that are produced by the ovary.
Okay.
Okay, they are produced by the ovary, and they play a key role. I remember saying last week that the estrogen play a key role in the lubrication of the vagina, and then the progesterone plays a role in preparing the uterus for implantation to take place, isn't it?
Exactly.
Yeah.
So
Good. So, what time along the line of the menses do you think the estrogen, or let's start with the progesterone? Do you think the progesterone will be high?
the one that prepares the uterus, right?
Yes, for implantation
I think around ovulation.
after ovulation.
After ovulation.
Yes, it's very simple.
Yes, it's true. After ovulation.
Yes,
You are right. You are right.
because we said it prepares.
Yes,
Okay.
prepares.
Okay,
Mm-hmm.
now pre-ovulation, which one will be high?
Estrogen.
Fantastic.
To lubricate the place.
Exactly.
To receive.
to release it as well.
I got
Yes.
this one right.
Exactly.
I got
So
it
this
right.
is very simple.
Yes.
It's very, very simple. Now, the higher estrogen, the higher the amount of discharge. Okay? And then as the estrogen level drops and progesterone takes over, the more it becomes thicker and creamier.
Right now, I'm lost. She will best
You
really-
can't be lost.
No, but we said, so now let's use ovulation as the middle.
Okay.
We said ovulation is day 14. So the middle of the whole menstrual cycle.
Okay.
Okay?
Mm.
So we said before there is more estrogen, after ovulation there is more progesterone, isn't it?
Okay. Yes.
So,
it is.
Before, so we know that the first 3 to 5 days, the discharge you see there most often is bloody. Now, after that, the color of the discharge you'll be seeing more, when the discharge will feel now watery, slippery, okay, and whitish, okay, but it's not. We'll come to the other white, okay, but so it's mildly whitish, but it's slippery. But when we get to the ovulation period itself, the discharge changes. The discharge now becomes egg white. It becomes sticky. So that is the kind of discharge that women going to ovulation will tell that, oh, there is some discharge that is more sticky.
Yeah.
Okay? it becomes sticky.
Yeah, man. So you be lost.
All I
Don't
can say is,
worry.
You know, and the egg white around that time is nature's own way to make it easily accessible for sperm to move out there.
not the penis to come in.
No,
Ah.
we'll talk about the penis one.
Okay.
We'll get there.
That's the one I'm interested in.
We'll get there.
Why are you
But
really
I'm
interested
trying
in
to
that
let
one?
people appreciate the difference in vaginal discharge according to your menstrual cycle.
Okay.
So pre-ovulation is light, it's watery.
Mhm.
Okay. During ovulation, it becomes sticky.
Cream, yeah.
Okay. The creamier one and thicker one is post-ovulation. So by then, it tells you that the water is drying off.
Mm-hmm.
Initially, it was watery.
Mm-hmm.
Now it becomes sticky. Post-ovulation, it becomes creamier and thicker. Then, just before you enter into your menses, it becomes almost dry. And sometimes just a yellowish discharge comes. So you see that it's not the same kind of discharge, the same amount throughout. Pre-ovulation, you will have more discharge. Post-ovulation, because of the effect of the progesterone comes to dry everything so that the baby is coming, oh boy. So it just dries it like everybody get ready for the new man in the city, the new baby in the city,
Okay.
and let every water dry up. That's what progesterone does.
Okay.
And then if unfortunately no sperm comes to, fertilize the egg, and then there's a shedding off, then now the discharge changes into a bloody one. So that is what happens in menses. Now let's go to the other stage. The other stages, or the other factor where these three things can change is the hormonal activity reduce drastically. Do
you know what's running through my mind?
Tell me.
So assuming I'm in my 40s, mid 40s, late 40s, and my wife is in her for menopausal stage and everything goes off fine. So now that estrogen is not there to lubricate the place, I have to buy a lubricant.
Yes, exactly. You see, that is why we need to be enlightened on it. The enlightenment helps you to prepare for it and not see it as an abnormality or like my wife is no more attractive to me. You just understand that it is nature. Prepare for it, and even now revitalize it and make it even more sweeter.
Okay, so if I'm getting this right, it just reduces, but it doesn't cease.
It is going to reduce, and in some instances, it even ceases.
Oh, that's scary to me.
Okay, wait. So I've said, I should have probably given you a number of the factors. Okay, like we're dealing with 5 factors. Okay, so the first one is menstrual. Second one is the hormonal level. Now the next one is sexual activity. That is where you came in.
Yeah, that is where let that
Don't
pussy
be
drip.
too active.
So
Okay, thank
so
you.
remember, we are still talking about the texture, the amount, and then what?
Appearance.
The appearance in all these stages. So we spoke about menstrual cycle. We spoke about what
Hormonal
else?
changes.
The hormonal activities. Now we are going to sexual activity. So think about these 3 things. Okay, what happens with the appearance in sexual activity? What happens? So that if I don't answer something, you ask me to answer that for you. Is that okay?
All right.
Okay, all right. So when we take sexual activity, the quantity, the volume increases just by arousal. Okay? So the quantity of normal vaginal discharge suddenly increases. There is a higher, and this is as a result of, again, estrogen and progesterone.
Estrogen at work.
Yes. Number 2, depending on whether you used protection or you didn't use, the discharge may change. It may differ. Exactly.
That's a fact.
Yes, of course. I mean, what do you expect? If you don't use protection, the discharge will be milkier, it will be whiter because of the mixture of the fluid, the semen, and then that of the vaginal fluid. So what will come out will be a little bit more milkier.
No, after you have not, the man has not released yet.
No, that one is, I have explained that one. Without releasing, okay, even without releasing, the whole friction and then the interaction, going up and down, that irritation will cause the consistency to change. The consistency of the vaginal
Is it because
fluid.
there's more skin to skin touch?
Yes. Okay. And also, after the ejaculation is being made, definitely this is a new consistency, a new feel. That is what is coming. It's more milky, it's more sticky, mixing with something that is more like light and fluid, depending on the stage the woman is at the time. Remember?
Yeah.
Okay.
Depending on the stage
Of the cycle.
cycle. Okay. So whatever that comes with, when it comes into contact with the semen, it changes the discharge at the time.
Okay.
Is that okay?
Yeah.
So I hope this is making sense
Oh,
to you. The appearance changes depending on the time. So when we come to sexual activity, arousal, protection or no protection, if there is protection, even the latex, the rubber, the reaction between the rubber, the oil lubricant around it, and that of the vagina, normal vaginal discharge alone changes the consistency.
Okay.
Is that okay? Then there is a certain level of an intercourse that there may be little or no lubrication. And
Why is that?
oh, I mean, of course. So that's a whole topic, and I call it the SRC, sexual reproductive cycle.
If you say
So,
SRC,
yeah.
you think
Mine,
about
I know.
students.
I'm glad I sent your mind there, but it's a whole topic on the sexual reproductive cycle.
Okay.
So, to be able to get to the orgasm and then the climax, as we always say,
Yeah.
a lot of things happen. Yes,
That to be a topic of interest to me.
Yeah. It's
Very
a whole
interesting
topic on
topic.
its own. Yes. First of all, you need to be aroused. You need to be, stimulated either by visual or by touch, by hearing or anything. All that, there is no penetration.
That's what they say.
Yes.
Getting into the mood.
Yes, getting into the mood,
In quotes.
Yeah, so
I'm a priest.
so there must be yeah. But the point is that all these things, if they are not there at the moment, it takes the female mind a little bit, back, and then the stimulation for the lubrication to come and all that will drop a bit.
Okay.
So people, expect you have to go back, stimulate a bit, a little bit of romance. And,
Doc, let's go
Okay,
to
Doc,
the
Okay.
Doc,
All
a
right.
question.
Yeah, so that we don't go too much into the SRC.
Yeah, no, we are not going
We'll talk
too
about
much.
it. Yeah.
But I heard that during this activity,
Yeah.
when the lady's mind is not really psyched into whatever is
Yes.
going on,
Yes.
there will be less discharge.
That is the point I'm trying to make right now. So you need to appreciate that the psych is an important factor in discharge here. That's all the point I want to make.
Okay, great.
Okay, in sexual activity.
So the more you do the foreplay and put the person in the mood, then there will be a lot of discharge. That will
Yes.
make it much easier for
Easier
penetration,
for penetration
and any other thing
and
that's
excitement, and orgasm, all of that. you
Okay,
know?
we'll deal with that topic later.
Yeah, we'll deal with SRC later. Don't
Okay.
forget. I sorry, we use acronyms to make life smooth. So
Yeah, I'll definitely.
yeah,
get that
when you
into the
guys talk
journal.
about SRC and all you think about student representative council,
Council.
I am seeing something else, guys.
Ooh, okay. I'll use that
so
word
yeah,
less.
so sexual activity. The other thing is pregnancy.
Okay.
Okay, pregnancy. During pregnancy, there is increased, progesterone and then estrogen. So if we have increased estrogen, what do you expect? There will be increased discharge. That is when we have higher discharge than normal. But again, because of the progesterone effect, it's going to be more thicker and milky and creamier. Sorry, more thicker and creamier because of the progesterone side. Progesterone dries the thing. Estrogen increased the amount. So we're having greater amount, but not watery. This time round, it is thicker. You get it?
Yeah.
And then creamier. That is what happens with pregnancy. However, there can be a moment when you have a more slippery and a lot, like a gushing of water. Once you see that, no, it is not a normal discharge, that is liquor. It's like the water has broken. That's what they say simply in English, like the person is has broken the water.
Which
Is that
water is
before
breaking?
labor?
That is before labor.
Okay.
Exactly.
Okay. Yeah.
Okay?
I get that.
So you expect to have the normal discharge should be a more creamier and then a lot of that in pregnancy. Okay? And then some people will describe it as a mucus, like phlegm.
Yeah.
That's what happens. And all this we're talking about is normal discharge. Everything we've said so far is normal discharge.
Doc,
Okay.
let me come in now. So now that your wife is pregnant and the normal discharge she's
Yes,
having
yes,
is creamy
yes.
because of the
Estrogen and then
estrogen. No,
progesterone.
progesterone more
Yeah,
because
yes,
progesterone is drying up the place.
yes, yes,
And if you want to have sex,
yes.
estrogen will still come into play
Yes, to
and
come to
make it.
play. It's to
Is
come
it
to
even
play.
advisable to have sex with your pregnant wife?
Oh yes, it's advisable.
Why do you want to stab us?
It's advisable. There is I can talk about like 10 importance of having sex during pregnancy.
That's another topic
That's
for
for
another
another
day.
day. Yes,
Mhm.
exactly. So
Okay.
just note it down, and
Lots of
I'm going
topic.
to, talk about it the whole day, and I'm not going to finish talking about the importance of sex, good sex during pregnancy.
Doc, a
Yeah.
moment. So, viewers, as we going on, you can also put in the comment section if you feel there's a topic we need to discuss that is of importance to you. Just feel free and just put it in the comment section. We'll grab that and then we'll do justice to it as well. So let's continue, Doc.
Great. So we've made mention of pregnancy. The last one is certain medications like contraceptives. Okay. If you are on contraceptive, it can alter the appearance, the volume, and the what?
Texture.
The texture. So in this case, contraceptive, we have so many types, okay? But when you look at the hormonal ones, we have the progesterone only, and we have the combined contraceptive, okay? I mean, it comes in many forms. You can have pills, you can have injection, you can have implant, and all that. But the ones that contains hormones, okay? You are either giving just progesterone, or you are giving one that is a combination of progesterone and then estrogen.
So
Wow.
you don't have just estrogen.
No. So we have just estrogen, but that is not necessarily used for contraception purposes. It's used in the menopausal women.
Okay.
Yes.
So you are talking about contraceptives.
I
Yes,
basically thought contraceptives were just contraceptives. They were not anything.
No, so they come according to the situation, what we are dealing with at the time. Because you see, that is why we have a lot of it. Everyone and the extra benefit you will get. Everyone and extra. So let me quiz you guys.
Okay.
Charlie.
What do you expect?
Uh-huh.
Oh, I'm going to ask you because I've said it already, and it's so simple.
Okay.
You are a very good student.
Please stop hyping me.
Very smart and intelligent.
Last week I tried him and he got 10 over 10. So let's go. Maybe today you will blow.
Ooh, no. Let's leave the men to
So
do the
let's
job.
say no. We want to hear from the women as well. Yeah. So let's say
Okay.
you take progesterone only contraceptive. How will that show in a discharge in terms of the consistency, the appearance, or the texture? Anyone?
Oh yeah, it's going to be creamy.
Creamy.
I knew you'd get it right.
It's gonna be creamy. It's gonna be thick.
Yes,
Yeah.
going to be thick
Yeah,
and
it's gonna
creamy.
be thick and creamy, and it's not a lot of it.
Yes, because we actually established that progesterone
It's drying up
comes
the
to-
place.
is drying up the place.
Yes,
Yeah.
exactly.
And obviously it's going to be creamy,
Creamy
and
and
will not
thicker.
come in large
Larger
quantity,
quantity.
and going to
But-
be thicker.
Exactly. So, but when you look at the one that has both estrogen and progesterone, it's both. So you are going to have a lot of it, but thick and creamy.
Okay.
So
So
they are both
quantity-
working.
Yes, both are working.
Wow.
So this is what you are supposed to expect. So before you come to the hospital and say, "Oh, I'm having an abnormal discharge," ask yourself, "What time are you? What medication are you on?
Okay.
When did you see it? Was it after having some good time with your boyfriend or with your husband? What's going on? Are you pregnant? Before you say, "I have an abnormal discharge," these are the things to consider. So that brings me to the topic abnormal discharge.
Okay. Back to the pill.
Yeah.
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 If you go to the pharmacy.
Yeah.
Where you want to get a contraceptive.
Yeah.
Are you supposed to be specific about what you want, or you just request
You're
for the
supposed
pill?
to be specific. Yeah, so the point is that there are a lot of options. Like I said, we have implants, we have injectables, we have the pills, we even have the surgical and all that. So you have to be sure what you want. If you are not sure, you have to ask for help. So what we do is that we offer you, we counsel you, we don't force it down your throat. So you have to say, "This is my situation. I just had sex 5 days ago, 2 days ago, one day, and then I want something to prevent pregnancy. What do I do?" Then they will tell you all the options. Then you decide what you want.
Okay, I'm asking because a lot of people go to the pharmacy and
Yeah.
just say they are buying this, but they don't really know like what it's about. Maybe whether it's just progesterone,
Yeah.
whether it's just
Yeah.
estrogen, or
Yeah.
whether it's both. And
Exactly.
the pharmacist over there doesn't really educate them that okay, this is doing this or this is doing that. They
If
just
you don't
go and
ask
say,
anybody
"I want
question,
this."
nobody will answer you.
Okay, because sometimes
Yeah.
the pharmacist will be like, okay, what do you want?
Yeah.
And then you are like, okay, I want this pill. And he is not interested in telling you that, okay, this is supposed
That's
to
a
do
gap.
this.
Yeah, I
You
agree.
get it?
That's a gap. So, I mean, this goes to tell our pharmacists, but I know people, other pharmacists or other medicine, chemical drug sellers or
Okay.
providers who take their time to explain the medication, the side effect, and all that. I know some really good people out there. But if you are one of those people who do not, get time to explain the medication and then the expected, side effect and what to do, please, advise yourself. It's not a good thing.
Doc, one last thing
we can
before
do
you
better.
continue.
Yeah.
So the post pills,
Yes.
they are also contraceptives, right?
Yes.
Yeah.
So do they also have any hormonal issues with them?
They
or?
do. They do. So they
Mm.
often are the combined contraceptive.
No, so you mean the contraceptives are hormonal issues?
Yes. So exactly. It's
Still not sitting well in my brain.
Okay.
Yeah,
So
so
all
it's,
these
it's not all that are hormones, okay?
Okay.
For instance, like we have something we call copper T. It's a metal that is placed inside the uterus,
Mm.
and it kind of makes the sperm. It makes it inhabitable for the sperm to even survive over there. It kills it.
Okay.
It kills it. So this is not a hormone at all.
Agreed. I
Condom
mean the
is
ones
not a
they
hormone.
have been
They are
swallowed.
hormones, yes. They are hormones.
Wow.
Okay, so I learned that.
Yes.
I learned that the pills they just stop the ovaries from producing the egg.
Exactly. So that's just one out of many other, depending on which one you are taking. Some prevent, some makes the endometrium really rough.
He's lost.
It makes the endometrium really rough
Mm.
that the sperm is not able to. How does it do that? Remember, we said, okay, maybe we are here to talk about that during sexual activity. The lubrication that is released by the vagina is acidic.
Yes, we discussed.
We discussed that before.
Yes.
And the one that is released by the semen is alkaline.
Yes.
Okay?
Yes.
And the combination of these two increases the pH to make it a little bit alkaline.
Yes.
And that makes it easy for
the sperm
to go. But it is not just the easiness in terms of the atmosphere being acidic or not, but it actually makes the road smooth for it to go. So when you take too much of a certain hormone, it makes it thicker,
Okay.
so that the road will not be smooth for you to go.
You can't swim.
You can't swim to go.
Okay.
Yeah,
Get
so
stuck.
so that is it. Like, it's not just the ovary release, but also it makes the pathway for the sperm to reach the ovary. It makes it impossible. It makes it inhabitable. It makes it so it kills it literally. It's a spermicide.
Doc, I know everybody's itching to hear about this.
I know.
So I want to hear that one.
So-
The ones that smell bad.
Okay,
That's
so,
what I want to hear.
So now let's go to abnormal vaginal discharge.
abnormal
So
ones.
to say someone has an abnormal vaginal discharge, it means the person doesn't have the three things we said in the normal way. So number one, it's an abnormal appearance. It's an abnormal volume,
Texture.
an abnormal texture.
Quick, there's one thing I think you are leaving out, which
Yes.
would be the fourth one.
Yes.
The smell.
Exactly.
The
He
smell.
wasn't
Thanks
done.
for-
He wasn't done.
So now, the smell is an important thing, an abnormal smell. And that brings the question: what is the normal smell of a vaginal discharge?
Okay.
I'm looking at you.
Okay, if I'll get this right.
Yeah.
I read somewhere that
Yeah.
it's supposed to, I don't know. Okay.
You continue. I'm
I don't want
listening.
to make reference to myself.
Okay.
So let's leave me out of it.
Yeah.
So yeah, I read that it's supposed to smell like onions.
Yeah. So that is it's a street, like I would say it's a common language on the street. but it's close to it.
Okay.
It's close to the smell of an onion, but it's just it has we'll say smellless.
Okay.
Smellless.
Yes, it's not supposed to have
Any
yes, a strong particular.
Mhm.
It's a mild, smell.
Mm.
Okay, close to the onion,
Mm.
but not harsh. The moment it becomes harsh, it becomes like really, high scented onion smell. There's a problem. Nyade Jojo.
abnormalities.
Abnormality.
Okay.
Mm.
Okay, so it's colorless.
Mm-hmm.
It's colorless. It's clear. It's odorless.
Mhm.
So the things you describe for water, colorless, odorless, that
That's
is
a
it.
normal
That is a
discharge.
normal vaginal discharge. But it may have some mild, mild onion, smell.
Mhm.
It's become slippery, okay? Slippery, depending on the time of the
Mhm.
cycle you are
The
in.
time is
Okay.
very important.
So now,
Mm.
what are the common abnormal vaginal discharge that we have or that
Okay.
presents to the hospital?
Okay.
We're going to talk about four common abnormal vaginal discharges that presents to the hospital.
Okay.
So the first one, and the most common presenting one,
Please calm down.
I'm
Calm
clearing my
down.
throat to hear it properly.
You are too interested.
the first and the most common
Mm.
is candidiasis.
Oh, okay.
Okay,
Yeah,
it's
very
yeast
common.
infection. Yeah, yeast infection,
Yeast
candidiasis.
infection.
Yeah. So this is what happens. What is the common, pH? You don't need to mention the value. I want to know whether it is acidic or it's alkaline in the vagina.
Oh, it's acidic.
Acidic.
Acidic. Thank you. Now, what is responsible for this acidity is a certain microorganism.
Okay.
Okay, and that microorganism has even acid in the name already.
Okay.
Okay, it's called lactobacillus.
Acid.
acid.
I had it right. No, doc. So this brings my question. So is that the reason why? Please,
Yes.
please, I don't want the lady to attack me.
Mm.
That ladies, their pants that side, no, the color they fade.
It tells you that something is wrong.
Ah, okay.
But people say that when a lady's panties fade, that
Yes.
means her discharge is normal.
No,
Okay.
it's not normal.
Doc, now continue
Okay.
before we get there.
Yes,
I think when you're going, you touch on it.
exactly.
Mhm.
So it keeps the pH within like 3.5 to 4.8. 3.5 to 4.8. So that's like very acidic. Highly acidic. It's a dangerous place. Highly acidic.
Hope it
But it's-
doesn't corrode anything.
It doesn't corrode anything. So this work of this organism
Mm.
is what keeps the place balanced. The moment it overworks or it underworks, there will be an imbalance in the place. Because it is not the only organism that there are other organisms inside the vagina.
Mm.
There are other organisms.
Mm.
There are bacteria, there are fungi,
Mm.
and the stubborn fungi in this situation is the Candida
Mm.
species. Okay? So, should the place become less acidic, then there is going to be an imbalance. And so, other organisms will now overgrow.
No.
Wait, if I'm getting you right,
Yes.
the candy already is in the vagina.
It's already there.
Why did you have to say candy?
That's the best way I can call it.
Okay.
Because you want to continue, I may get it wrong.
Yes. Yeast.
So it's already, the yeast is already
Already there.
there.
Already there. Already there. So we call them normal flora. Normal flora. As you see your skin, there are microorganisms jubilating, moving, having a normal lifestyle right now.
You're scaring
That should
me
we
now.
put a microscope there?
Yeah,
You're like,
fair.
what is this? And that is the reason why you have a healthy skin today. Because this is their secretion that is making your skin this healthy in terms of its smoothness, in terms of it being healthy against infection.
Mhm.
Sweat is because of the organism on top. They feed on the sweat. So we have normal flora everywhere. We have normal flora in your nose, normal flora in your mouth, normal flora in your intestine. Actually, this candida is even in our mouth. We have candida in our mouth,
Wow.
candida in our intestine, candida in the vagina as well.
Mm.
So anything that will cause the amount, which is a normal state it is enjoying over there, to increase, it will end up showing you signs that we there here, we were just living a normal life. We were there already.
Okay.
So they are there. So it's not just the candida. There are also other organisms, like I said. So once the pH changes, when it becomes too alkaline, so it's not like so we for instance, when there is semen, it will just raise it a little bit above the neutral, the 7.
Okay.
So it moves from 7.2 to 8. But we are talking about extremely alkaline, okay, 10, 12. Then all the silent organisms that were just living their life are now going to become gangalia.
They become
You're not going to become, yes,
very
active, and now they will start multiplying and they will start, showing you the signs. And so if they were fungi, if they were the yeast, what we see is the candidiasis. So the effect is the woman presented with a discharge, which is this time round whitish.
So
It
is
is
it
thick.
sorry,
Yeah.
is it the microorganisms to that causes the itching?
Exactly. So it becomes white, thick, it becomes cheesy, like wagashi. It becomes,
No, white like egg white.
egg white. Yes, egg white.
That plain white.
Yes, white.
Okay.
Becomes cheesy. Then now you have itchiness, you have burning sensation. Some even feel pain during intercourse as well. So,
It doesn't. What of the smell? How's the smell going to
and
look?
it smells.
Why are you so
Really bad.
interested in the
No,
smell?
Because he mentioned sexual intercourse, and you
Yes.
go and dedross yourself in
Yes.
somebody's room. I need to
But
buy air
you should
freshener.
know better.
I don't know.
So that is it. Now, on the other side, if you are lucky, and then the yeast ones, the fungi ones, say, okay, this is not enough for us to multiply, but rather the other bacteria there start to multiply, it will also now start to show you a different sign.
Is that the second one you're talking
The
about?
second one. So we call that one bacterial vaginosis.
Okay.
Bacterial vaginosis. The vagina is inside already. Vaginosis. So there's a stubborn microorganism in there that will start to now grow horns. So instead of the candida this time around, and guess what? It has garden in the name.
It becomes a whole forest.
Gardnerella vaginalis. Gardnerella vaginalis.
It sounds like
It was a garden you were growing, and then now something went wrong, and so now
Guardiola. It sounds like that.
No,
Guardiola.
So when they multiply, and now you have this what we call bacterial vaginosis.
Okay.
And guess how it smells? Fishy smell.
Okay, that's
Yeah.
why some people complain of it smelling like tuna.
Like
Like tuna.
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 Yeah.
Exactly. So you see, what happens?
No, that's
is
what we say. Emumu in Efe.
Hey, oh, I see. Now, this one, it's even worse after intercourse.
Okay.
And the reason is that the semen, when it adds, it's already smelling. There's already a problem. But when it add it alkaline effect on top, so that is why the men are the ones who will complain to you. Because all was okay and all that until he released. Immediately, the semen touches the acidic medium. It will increase the pH. And so it's becoming more alkaline. And it's allowing more room for the spread of the bacteria. So it's just going to be.
Within that short period.
And then when it does that, it starts to break down the proteins inside the vagina fluid. So proteins like egg, once the proteins start breaking down, the smell.
Doc, let's move to the next one.
No, wait, relax. So immediately after the secretion, and then it starts to really smell within that short period.
Yeah. But mind you, the problem was already existing. It only got worse because of the increase in alkalinity.
Doc, because of our time, let's move from the fishy smell. I'm not feeling comfortable.
Okay, so we mentioned two conditions.
Yes.
The third condition is sexually transmitted infection in general. So you see, these first two can exist with or without sexual intercourse.
Okay.
Somebody I said, but I'm a virgin. Why am I having white? No. You can have candidiasis is not a sexually transmitted infection.
Okay.
So my husband traveled just when he returned from his trip. I started having discharge. No, this whitish discharge you are having, it's not from sexual.
Doc, some attribute it to eating too much candy or sweets.
That's true. So I forgot to add that the foods you take can reflect.
Lifestyle issues coming again.
Yes, can reflect in the discharge. So if you take coffee, you take sugar, if you take onion, a lot of onion, it's going to taste like onion down there. And that is why, unfortunately, all the things I've made mention of, they don't, allow too much of the microorganisms to multiply. But sugar, when you take a lot of sugar, even when you are a diabetic and you have a lot of sugar in your urine, it allows the organisms because they feed on the breakdown of the sugar to multiply.
Okay.
So that is why it is going to allow candidiasis to fester.
Okay.
Doc, let's move to the third one.
Right. So the third one, I said, is sexually transmitted infection.
Yes.
So we have the likes of gonorrhea, chlamydia, trichomoniasis.
No, Doc, before we go there, I think for the bacteria, you never spoke about the texture, the color, and all those things. I think if you can quickly throw light on that.
Yeah, so you mean bacterial vaginosis?
Yes. What is the...
So bacterial vaginosis is normally thick, and it is gray.
Gray?
Yes.
Wow.
Whitish gray.
Okay.
Okay, it's gray. It's yellowish gray.
Yellowish gray.
Yes, gray. But it comes with a fishy odor.
Okay,
the fishy odor. And it may be a lot of it.
Maybe
a lot, yes. Now, when we move to candidiasis, chlamydia, STDs, chlamydia and gonorrhea. Gonorrhea is yellowish. Yellowish discharge, yes.
I'm always interested in the smell.
So the thing about that is the smell may be likened to the fishy one. Okay, but the key thing that you will see that would let you know that this is gono is the yellowish color.
Okay,
and it's watery. It's not as thick.
And yellowish.
Yes, watery, and so it's coming like
a
lot of and then we have greenish yellow in the other one, the long one, the trichomoniasis.
So the STDs have different colors
depending on the condition, different colors.
Doc,
and chlamydia is one of the most stubborn because apart from this color I've given, it's hard to diagnose it. It can be asymptomatic. You can have chlamydia and even have nothing, have no discharge, change in the color.
Okay, Doc, you know what? As for the STDs, I don't want you to bother yourself so much about that. We will be delving so much into that subsequently. Okay. So let's move to the fourth one.
So the last common, the reason when it comes to discharge that patient presents has got to do with pregnancy. Okay. So pregnant women, a lot of times they'll come and tell you, okay, I'm having this. Most of them used to, come with different kind of discharge. And it can invite the top 3 conditions we've made mention of earlier. It can invite candidiasis. So the patient will come, doctor, I'm feeling a low abdominal pain, go down there, and then you will see that.
What did you just do?
Is it in the early stages of pregnancy?
Any stage, you can have it. Any stage. But the latter part, it even gets worse the more it progresses.
That's why it's not advisable to have sex with your pregnant wife.
No, it is. No. You can't say that. Okay, so a quick one. So now let's talk about lifestyles that can lead one to have a change in the color, change in the smell.
Exactly.
We know, of course, sex. Yes, having sex, especially multiple sexual partners, increases the chance of changing the pH, festering, or multiplying a certain organism over the others. Okay. And also introducing the sexually transmitted ones in there.
Okay.
Okay. So multiple sexual partners, unprotected sex. 2, poor vaginal hygiene. So poor vaginal hygiene can cause abnormal vaginal discharge. So in this case, we are talking about use of douche. Okay, some people insert things. They insert certain things, vaginal tightness. So creams, certain materials.
This is it. Gloves or
clothes. Some use garlic.
Gloves, herbal, just to those things. The more you insert it there, remember the environment is acidic. The more you do it, you either make it more acidic or more alkaline. And remember, we said the moment the pH changes from the normal state, something increases, and that is what will cause it. So that douching, the wiping, okay, the cleaning, it should be from front to the back, and not the back to the front.
Not the back to the front.
Yes.
Otherwise, you bring
pick something
emikwi down in there. Okay.
Whatever that means. Yes. That is it. Okay. So yes, that's all under personal hygiene. The cleaning, the washing. Okay. The washing shouldn't be with a high scented soap.
Okay.
Or this, what do you call
Cleansers
and all that. Just the normal water. Just the normal water and soap. It's like how you clean your skin, your face, and all that. Because remind you, any discharge you were seeing there earlier could be a normal discharge. It's just depending on the time you are going through. That is why it may be increasing or not. Now you say that, let me go and apply something. Before you do, you will change the pH, and then something will go wrong. You get it? Okay. So you have to be mindful of, the kind of soap you are using and the things you are applying over there. Other things to do to, that can result is smoking.
Again.
Wow. Interesting.
Smoking, yes, it will reduce
How
your
did
immunity.
Smoking get down there?
Yes, it reduces your immunity, and it also goes a long way to reduce the immune factors protecting the vagina, epithelium. So
people say use of public toilets because of especially the PTM.
Yeah.
And the heat.
The heat.
Yeah.
They say it also affects the vaginal health.
There is not enough research to support.
There's not enough research.
Yes, to support
so all these are the releases have been
thing.
deceiving us.
Yeah, I don't know. Like you have even professionals, you have highly learned people, believing that because I changed my restroom and I'm now using the treating, that is why, that there is not enough research to support that. But the closest explanation will be what I'm about to say.
Okay.
The use of tight undies. Okay, if you use tight undies, it doesn't allow good airflow around the place. It keeps the sweat on it. And mind you, as I said, every food you eat, okay, is also excreted through sweat. Okay, so your sugar that you take, the onion, the drink, the tea, everything, you excrete some through your sweat. And this sweat comes in contact with your undie, your clothing, anywhere, and your skin, you react to it. And so imagine when it comes into contact with the vaginal discharge, it changes the pH and something goes wrong. So we advise that you should use a cotton, wear instead of the very tight, hot ones.
Nylon.
It makes the place hot, and that can also change the pH. So that could be connected to to explain why that maybe the heat can change. But that's how long do you sit on it? How long that it must be a powerful heat that blew through the place, man, to cause all that. So I would like to say, let the pussy breathe.
Don't let it drip. Don't let it drip.
Okay, so any management tip you want to give quickly about that?
Management. So when it comes to management, it is by doing the reverse of all the things I have said that causes abnormal vaginal discharge. So ensure a proper vaginal personal hygiene. Okay, no douching, using mild soap and water to wash the place. Clean the place from front, to the back.
Not back to front.
Not back to front. You know, yeah, wash the place just after intercourse. Wash the place. You know,
partners.
Yeah. Try to keep one sex partner protective sex. You know, use cotton-based, you know, undies. So that's it. That's basically. Then the last thing is report. See your doctor anytime you suspect that this discharge is an abnormal one from the usual one I used to have. That's all.
Wow. Anyway, so the last comment: see your doctor. Well, thank you so much. It has been a very educative section with Dr. Victor Loglo.
Thank you.
And Jasmine, I call it Jasmine Perfume Rice. She says no.
Please.
Jasmine Gantua. So it's been very educative, and we've been talking about vaginal discharge. You have heard it all, and it's up to you. Take very good care of your vagina. Charlie, it's one of the reasons why we are struggling in life. You get that? If that place is not smelling good, the gentleman will just they don't say anything. You just dress, you go home. You go home. And that is the end of your relationship. Whether or not he says it, it's up to you to take very good care of your vagina. Okay, so he has said it all. If you are seeing any abnormality apart from the normal ones he has spoken about, please don't go inserting ginger, gloves, garlic, and the douching he's mentioning. I don't know what it looks like. And using those vaginal tightness and all those
douching.
things. That's the douching.
Yes.
Yeah. Don't do that. Just quickly go to the hospital and report it as soon as possible. A stitch in time, they say, saves 9. Ladies and gentlemen, it has been your usual host, Pius Atoni, and this has been the health segment. Thank you. And do not forget to like and share with other friends so that this information can go wild. You get it? Is it wide or wild? Whichever it is, just make sure you do share. And if you want to sponsor us, be free to come. Our contacts are just below the screen. Just dial the number and get in touch and sponsor this beautiful program. See you with another interesting topic. Bye.